even have time to find them on a fecal. So we also talk about prepatent periods. So the prepatent period is the time that from ingestion of the egg, so it goes through all this life cycle and we have adults again. And the reason prepatent periods are important is at times when we're going to give our deworming. So most of these require more than one deworming, and we have to time those based on their life cycle. So for roundworms, it can be as short as 2 to 4 weeks, up to 8 to 10 weeks. It depends on the species and how they acquire them. So what are the symptoms? Where it's our younger animals that get the most severely affected. And so we can get vomiting, we can get diarrhea, we can get a distended belly, we can get impaction. If there's, you can see how many worms are in that picture of the GI tract. Intussusception, that's a fancy word for when the intestinal tract telescopes upon itself. So think about a drawstring on your sweatpants and you pull that drawstring. When that intestinal tract has stringy worms or a string form body in it, they work the same way. And that is the life-threatening condition as well. These worms can also cause pneumonia because they can migrate to the lungs, just what we call failure to thrive and a general unthrifty appearance, and even death if they have enough of them. So in the general population, so including adults, we see it as up to 30%, but it's much, much higher in our youngsters. So it is assumed that all puppies and kittens have these, since you just found out how they can acquire those. And so it's recommended we start deworming them at 2 weeks of age. As they get older, it's thought to have some age-related resistance to this parasite. As far as treatment goes, and I'm not going to go into brand names or anything, but there's oral medications, there's topical medications we can put on. So we have a lot of treatment options for these. And are they zoonotic? Yes. So people can get these. So here are a couple of examples we have people. One is called visceral larval migrans. So this means we've ingested that larvated egg, that larva hatches out, and it can migrate to common places through the lungs. So it can set up pneumonia. Ocular larval migrans happens when it's going to the eye. This is very prevalent in children, especially in the Southeast United States. The warmer temperatures, we have lots more parasites in the soil that aren't killed off by harsh weather. And so kids are playing in the sandboxes, go in, eat their sandwich, they haven't washed their hands, things like that, or they're just sticking their thumb in their mouth to suck on it and they've been playing in contaminated soil or sand. That's going to happen as well. This one happens to be migrating underneath the eyelid. And then for our pet, so this is a puppy. You might think, oh, he looks kind of fat. He's got a big belly. But if you look here, you can see his ribs. So he's actually a really skinny puppy with a
Dr. Nelson, I'm sorry, I don't see your screen.
Oh, it's not showing up?
No, just wanted to.
Let me try this again.
Just realized you were referencing pictures and I didn't see any yet.
Yeah, I need to bring this back up here real quick. Hold on a second. Well, that's not good if it's not showing up. I'm just going to reload this and try this again.
Yeah, I know. We had your presentation pulled up and everything.
Yeah, okay. I'm going to try this. Let me get this there. Okay, let me go back. Try sharing the screen again. And it is not showing up.
Let me see.
We did have it pulled up earlier, correct?
Yes. Give me just a second.
I'm trying to figure out why it's not showing up on the share here, because it was on there. I might need people with more technology than me. No.
Yeah, I saw it earlier.
Let me try this and see if that will do it. That's still not bringing it up, is it?
Hold on. There we go.
Hold on. I got a new share. Is it showing up?
I do see your screen, so you might just need to select the presentation mode on your PowerPoint. There we go.
Is it showing up for you? Because I'm not seeing it.
Yes.
I'm going to make me smaller. Okay.
Yeah, there we go.
All right. Wow. Gotta love technology. Okay, and let me get presentation mode. Hopefully not from the beginning. You never do that from here, so hold on just a second.
There we go.
All right, let's get to where we are. Okay. All right, so we kind of went what they are. Let's go to, here's the growth pictures for people that are in here. And so you can see that. And then here's, can everyone see this now? Hopefully. Okay, here's our
Yes.
skinny puppy with the big belly. Okay, and so this is an intestinal tract that has worms. We often have owners describe these for us when they say they're seeing worms. And one of the options we give them is we ask them if they look like spaghetti. And so as you can see, they're kind of very long. This is a picture an owner sent me. One of her kittens had eliminated this in a litter box. So they were in the litter box, but she put a toothpick just for perspective in there. And then these are actually what the eggs look like when we run what's called a fecal float to try to detect those. Okay, so I have a question for y'all, and because we're running a little behind, I'm just going to answer for you. But how many eggs can one female roundworm lay in one day? Up to 85,000 to 200,000 eggs per day. So when you think about this, this is why we really need to deworm these guys, because they're shedding these into the soil. Our kids are playing in them, our other pets are playing in them. That's a lot of eggs. So if you look at this picture that was nicely sent to me by our parasitology service we have here, this worm is full of eggs and she's laying all these eggs. So that's a lot. Okay, we're going to move on to hookworms. So this is another parasite that lives in the GI tract. It affects both dogs and cats. Again, some affect both species, some only dogs, some only cats. Like roundworms, they ingest the infective larvae so they can get them directly from the environment, or things like cockroaches that have these that they're transporting them on. Again, a vertebrate host such as a mouse. They can get these via milk. They can't get them through the placenta, but they can get these through nursing and through skin penetration. And they have this common name, hookworms, because if you look, they have these little hook-like projections basically in their mouth area. These guys latch on to the lining of the small intestine, and they're the little vampires of the intestinal tract. They suck blood. And so their pre-patent period that we talked about earlier for them is as short as 2 weeks and up to about 1 month for that. So symptoms, again, it's our youngsters that are most severely affected. It can cause severe anemia. So because they're removing so much blood from these guys, what we call dark tarry stools. We'll show a picture of that in a moment. Diarrhea, really skinny and emaciated. Dermatitis, so again, this can go through their skin as well. Pneumonia, failure to thrive, unfit the appearance, and death. The general population of the 36%, again, we assume most puppies and kittens are infected. And thankfully, we have oral and topical options. The scary part is right now, and this is something as veterinarians we're having to deal with in the present, is we have resistant strains that have been developing. These developed out on the greyhound racetracks. Most of these racetracks have closed down. Greyhounds have been adopted out, and unfortunately, these resistant strains are now spreading out to the rest of the population of the dogs. And our traditional dewormers that we have for them, a lot of them are not working, and these dogs are dying from their hookworm disease. Are they zoonotic? Yes. So the other scary part is we have these resistant strains and people can get them. So in our pets, this is on what we call a necropsy. So it's like an autopsy, just called a necropsy for pets, like an autopsy on people. This is a piece of the small intestine. It's been sectioned, and you can see this is that black tarry looking stool that they talk about. And this is all just blood that's been in there. Again, another picture with those little kind of hook-like projections. In people, there's a condition known again as cutaneous larval migrans, just like with the roundworms. A lot of times people get it in their feet walking on sandy beaches. So when you go to sunny Florida where it's warm for a long time, they don't have a lot of cold spells, we're going to see more hookworm issues. This person had it on their belly from laying down. Again, probably working in the soil, they have it on their hands. Okay, so another question is going to be, so how many eggs do hookworms lay per day? Up to 25,000. So not as many as roundworms, but still a significant amount. Okay, the next parasite, intestinal parasite we're going to talk about are whipworms. So these are primarily in North America, a dog problem. They're very uncommon for cats. So they get this by ingesting the egg out of the environment. These have a longer pre-patent period, up to 3 months for this pre-patent period. They get their name whipworm because at the very end, they have this little whip-like tail on them. Symptoms is often diarrhea. That's what we call large bowel diarrhea because it affects the large intestine. There's usually a lot of mucus and a lot of bright red fresh blood we see. They can also get weight loss, dehydration, anemia, and even death. It can also cause electrolyte abnormalities. Prevalence is thought to be 10 to 14%. So this is a dog who was heavily infected with whipworms. Obviously didn't make it because he's sitting here on the necropsy floor. So we have, again, oral and topical medications. Some of these are included with heartworm preventive. It's thought to be unlikely zoonotic, so that's the only good thing about them. So one last question here. How many eggs do whipworms lay per day? They have a really pretty egg, don't they? So about 2,000 per day, but they are what are called intermittent shedders. So they don't always shed every day. So sometimes we have to run several fecals in a row to try to get a diagnosis. The other problem is these eggs are very, very heavy and dense. And so our normal, what we call flotation solutions that we run our fecal floats with, these will sink to the bottom and we're taking our samples from the top. So again, another reason why they're easily missed. Okay, the next intestinal parasite are tapeworms. A lot of you have probably heard about these. So on a fresh stool, these usually come out as individual segments. I'll show one where they're all in one piece. And they look kind of, when they're fresh, kind of like little white things on there. But as they dry up, we can find these on the hair around the anal area. They can look like little pieces of rice or little cucumber seeds there. So dogs and cats can get theirs. There's a lot of species of tapeworms. There's two of the most common ones we're going to talk about right now. So how do they get these? They have to ingest what's called an intermediate host. So it's something else that's ingested the larvated cyst, and then in turn, the animal ingests that intermediate host. So for one form of tapeworm, the intermediate hosts are like rodents and rabbits. For another form is from eating fleas. So they don't get them directly from eating the stool or walking through the stool and licking their paws. They have to eat these intermediate hosts. Pre-patent period is short as 2 to 3 weeks up to a couple of months. The good thing is they often don't cause a lot of disease. Usually it's fairly mild. It might make them a little itchy around their hindquarters, rarely impaction. But they are fairly prevalent and they're very hard to detect again on routine fecals because these eggs sink to the bottom. Most of the time we have owners calling us and saying, I'm seeing these white worms or I'm seeing these little things hanging on the hair around the anal area. So when we ask them to describe them, they almost always describe tapeworms to us. This is one where all the segments are in one piece. So after we got it cleaned up, you can see that's pretty long. Those of you in the younger generation may not know this is not a cell phone. This is part of a handheld phone that goes on a mounted area. So that was probably about 5 inches long or so, 6 inches. So treatment, again, we have a lot of options. The other tapeworm we're going to talk about here in just a moment, the Echinococcus, we only have one treatment option for that one. So for the two more common ones, the ones they get from eating rodents and the ones they get from eating fleas, it's not thought to be really zoonotic because we don't get them directly from our pets. However, if you happen to have your mouth open and a flea carrying that egg hops in your mouth and you swallow it, or you're eating like some raw meat from a rabbit or something like that, don't recommend that, you could get tapeworms. So this is a little video of some tapeworms that we took that a dog was sitting on our table, got up and left us this little nice present that was there. So you can see they kind of stretch out, elongate. This one's starting to dry up. It's becoming one of those little proglottids that's there. Okay, Echinococcus is another tapeworm. This one causes a lot more serious disease, and this one can be fatal. It forms large cysts in the liver, lungs, sometimes even the brain. It's found most commonly in people that raise sheep. It's fairly uncommon in North America, but it does exist. This one you can get from direct contact with the infected dog who has these little proglottids on their coat or the fecal matter, and then you're not washing your hands before you eat. So this is a picture of a brain, an MR. This is the big cyst that's in that brain. This is the liver from something, but I think what you can tell is all these little cysts that are in there. And I'm assuming, and I'm trying to remember where I got this, but I think this is actually a brain where they're cutting out a cyst that was into there as well. This is a mouse, so it's pretty small. Again, these are all these little cysts that are forming in the liver. This thing here is the size of the worm. You might go, well, wait, it looks ginormous, but I know this might be hard for you to see. These are only 2 to 3 millimeters long. So they're very, very tiny. So they're hard to see when they're attached to the coat of a dog. Their eggs look exactly like the other tapeworm eggs. So we can't differentiate on a fecal float, or even if we find the eggs, if these are Echinococcus or the other 2 more common species that we see. So these we have to be very careful. All right, another intestinal parasite is called Coccidia. And this is not actually a worm, it falls in what we call a protozoite. So it affects dogs and cats. There are a lot of species. They are host specific. So cats only get the cat version, dogs only get the dog version. How do they get these? They ingest the cysts out of the environment. So again, contaminated feces, soil, things like that. Ingestion of the transport host. Their prepatent periods as short as 4 days up to 23 days. What do we get? Diarrhea, sometimes bloody, weight loss, dehydration. They can have decreased appetite, vomiting, depression, death. It's our young animals who get they're the worst affected, get the most severe disease. They're often stressed, they're often immunocompromised as well. Adults are often asymptomatic. So if we have what we call a routine fecal brought in for their annual exam and it looks normal, the adult dog is normal, we don't treat those guys, but we do treat any puppy or kitten because they can get so sick from it. So these are very, very tiny. You need to see these on a microscope. Prevalence, you can see that prevalence rate is about like the other ones. There's a lot of different treatments, and thankfully they are not zoonotic. Okay, we're going to move on to Giardia. Some of you may have heard about these. When we stain these are really pretty. They look like they have little faces. They're not faces, they're organelles, but they're really kind of cool to find. So they affect both dogs and cats. There's a lot of species. In general, we're discovering they're more species specific than what they once were thought to be. So if we diagnose these in a dog, we only treat the other dogs in the household. If we diagnose them in a cat, we only treat the other cats in the household. How do they get these? This is called the trophozoite form. I'm going to show you a cyst in a moment. It's these ingestion of the cyst from contaminated food, water, grooming each other. If it's stuck to their fur, that's how they get infected. Prepatent period is short as 3 to 10 days. Like a lot of our other parasites, diarrhea, weight loss, dehydration. This also causes malabsorption, maldigestion. So these guys definitely start losing weight and don't look that good. Their stool usually looks very poorly formed, kind of a grainy appearance. There's regional differences. It kind of depends on the time of year. We actually see quite a bit of Giardia here. Treatment, there's a lot. They're all what we call off-label. So there's no approved use drugs that we have in the United States, but we have a few we use off-label. Are they zoonotic? Yes, people can get Giardia. It's very rare to get from your pets. Usually you're going to get from drinking like contaminated water if you're out camping, things like that, or go to a third world country and you're drinking some of that water. So this is a cyst that we saw under the microscope. This is unstained, so that's what we're looking for. This is the trophozoite again, so this is a stained one. This is what a trophozoite would look unstained. So we're looking at these on fairly high power to find these. I will say one thing with Giardia we're starting to run into over the past several years is we are having resistance to our treatments from these as well. So these have been a little bit of frustrating, even more resistance than we have with whipworms at the moment. So as far as internal parasites, intestinal parasites, here's some general guidelines. Puppies and kittens, they recommend routinely starting deworming from roundworms and hookworms starting at 2 weeks of age, going every 2 weeks until they're 8 weeks old, and then they should go on a monthly preventive after that. Adult cats and dogs should be kept on a broad spectrum monthly deworming product. And then also it's recommended adults have at least 2 fecals a year, and puppies and kittens anywhere up to 4 or more during their puppy kitten series, because they're the ones usually we're finding all the parasites in, and we have to see if our dewormings are taking care of everything. Also, try to keep them from going out and hunting. So you might have barn cats. That's why you have them. They're out there to hunt the mice and the rats. But if you can limit the scavenging of your pet that's living in the house, that will help keep them from getting some of these parasites. And then prompt removal of the feces from the yard litter box is going to be important. Some of these don't become infective until they've sat a couple days and gone through a few transition phases. So if we can get them out right away, it can make them less infective. So besides picking up stool after walking your dog just because it's gross and we don't want anyone to step in it, this is a health reason as well. And then the leash laws too, and just enforcing those. Okay, another internal parasite are heartworms, and its name kind of alludes. This is a parasite that affects the heart and the lungs, but they do like to live in the heart. Both dogs and cats can get these, but dogs are by far the preferred host and most susceptible to disease. So how do they get these? They get these from an infected mosquito bite. So the mosquito carry an infective larval stage. So from the time of that bite till they grow to be adults is 6 to 7 months. Adults grow to be anywhere from 12 to 18 inches long, so they can be very, very long and living in a small heart. So what do we see? We see symptoms of heart disease, so coughing, weight loss, exercise intolerance, respiratory distress. We can have a big belly because as the heart starts to not work, we have fluids start backing up. Vomiting in cats, we don't really see as much in dogs, but we do the cats. Also neurologic signs are more common in cats because these tend to go to other areas in the cat because they don't like to live in cats and not the preferred host. So sometimes we find them in other parts of the body. And then death is often a sequela if they're not treated. So we do have prevalent differences. The warmer the areas, like the southern and southeast United States and the Mississippi River Valley have the highest incidence. And I'll show you a map here in a moment. So this is a dog, picture of a dog with advanced heartworm disease. Again, you can see it's kind of bony up here. It's losing muscle along its spine. So this is an actually skinny dog. His belly's full of fluid. That's because the right heart has failed. Fluid is backing up there. So we do have treatment for dogs. There's no great options for cats. And even though we have treatment, it's expensive, there's still a possibility of death. So what do we want to do? We want to try to keep them from getting disease to begin with. So we have options for both dogs and cats. For the dogs, we have pills, topical, and a 6 to 12 month injection. Cats, we have pills and topical. You want to use these year round, especially in Kansas as well. When the freezes really hit and mosquitoes go away, it's highly variable. It can be into early December before we see that happen. And then when it warms up, we see mosquitoes again, also very variable. Oftentimes we see February, enough warm days where the mosquitoes are out again. We do want to test dogs before starting preventive, just because there's some problems that can happen if we start it that we want to try to avoid. Are they zoonotic? We do not get these directly from our pets. However, there are reported cases where people have gotten these from mosquito bites. They're rare, but they're there. So this is under a microscope. This red stuff are all red blood cells. So we're on a really high power. This is what we call microfilaria. So this is the baby form. These are also microfilaria where we use a special chemical to kind of straighten them out, and it helps us make a better diagnosis. This is a dog, and probably from the southeast, I'm going to guess, United States, chock full of heartworms. You couldn't get much more into that heart. This is a video of where we took some blood, we spun it down, we separated the red cells from the serum or from the plasma, and here we see the microfilaria that are moving around. So this is what is in their blood. And these are one of the things we're looking for when we're checking for heartworm. So it kind of makes you cringe when you think about that. So there's a society called the American Heartworm Society. Every 3 years, they have their triennial conference. Every 3 years, they put out a new incidence map so you can see we're getting due for a new one. So this is the latest map that we have. The darker areas are the higher prevalent. The lighter ones are lower prevalent. So this is from 2019, what we saw. And then this is just the trend over time. Again, you can see the Mississippi River Valley, that's southeast United States, down to Texas, all hot spots. But see how this got bigger and bigger with the hurricane, especially when Hurricane Katrina hit several years ago. A lot of dogs were transported from Louisiana to other parts of the United States. So parts of the United States that didn't have much heartworm now have heartworm because of all the distribution of the dogs. Okay, another question for you. Ringworm, is it a worm? No, it's a fungal organism, but we do have a lot of clients thinking it is an actual worm. Okay, that's enough for the internal parasites. So we're going to move on to our external parasites. So the first one's going to be fleas. Most of you are familiar with fleas. And believe it or not, you can tell an adult flea from a juvenile flea by how they look. Yes, they're both very tiny. Your adult flea is a little bit bigger, has a more amber, translucent abdomen back there. Your juvenile is very dark. And we have a few of these caught under tape. You can see there's a juvenile compared to an adult, so we do have a size difference there. This is important to determine this when we're trying to decide if we have a resistance issue going on, when we're not getting control of fleas in a household, or if it could just be we have an overwhelming population of juveniles that keep hatching out. So we need to know percentages of how many of these we have. Okay, so who can get bitten? Both dogs and cats. There's a lot of different common species of fleas, but the most common flea for both dogs and cats is known as the cat flea. How do they get these? They get these from the environment. These like shady areas. So you're not going to pick these up from an expanse of sunny lawn because they don't like that. They like the shade and they need organic debris. So they're going to be around foundations, under bushes, things like that. And then directly from other animals. Pre-patent period can be as short in favorable conditions, as short as 13 days, or they'll wait to hatch out 50 weeks later. Symptoms, we get itchiness, hair loss, infections, and skin infections, anemia, and death. These guys also suck blood, so they can cause some pretty significant anemia. They are carriers of other diseases. We talked about tapeworms just a little bit ago. Prevalence, they're widespread, but they're very uncommon when humidity is less than 50%. They need humidity for survival and for their reproduction. Okay, so down here, these black things on this white piece of paper are flea excrement. There's a whole bunch of flea excrement, otherwise known as flea poop. And we often show this to clients who are telling us that their pet cannot have fleas, because what we do is we take up a little bit of that, we put some water on it, and you'll see these black things start to dissolve into red. That is digested blood that the flea has excreted out of its body. So that is our proof, yes, indeed, they've had fleas on their body. This is a classic, what we call a classic pattern for flea allergic dermatitis. We see hair loss over the lower back and the tail. When you see that, you can almost always bet there's fleas going on. Okay, so thankfully we have a lot of options, a lot better ones than when I got out of school, because we didn't have a lot of great ones. We have a lot of good ones now. Unfortunately, fleas are great at developing resistance to our products, so new ones are always having to be developed. We have topicals, we have orals. The main thing is you don't want to wait until there's a problem to start your preventive, because by then you have all these eggs, all these pupal cases that are in your environment. They're just waiting to hatch out. And so you'll be fighting them for a while. Are they zoonotic? Yes, they will bite people as well. They can transmit cat scratch disease. They carry some forms of typhus, tapeworms, plague, and then allergic dermatitis. People can get it as well. So our nurses like to do this. This is a video of some flea eggs that they kept under tape for a few days. They're now hatching out into their larvae. So those are flea larvae. Those are what hatch out in your carpet in your house if you have an infestation. This is a video of fleas that are running around on a dog. And so you can see they're scurrying like mad. This was a Scotty. So he's a black-coated dog. Had some elderly clients that owned him, and they couldn't figure out why he had skin disease. Well, it was hard for them to see the fleas through his fur. Here he's on his belly, and so there's not as much fur in through this area, in the inguinal area, and you can definitely see the fleas. So this guy had flea allergic dermatitis. This is a little what we call a Good Samaritan puppy. Someone brought it in, who I just can't make this look white enough. This guy was almost as white as kind of this tape that was on there. This puppy had severe flea bite anemia, and when we handed him to our nurse to hold so we could get some blood, the fleas just started bailing off onto her. It was pretty gross. So this is comparison. This is what we call a packed cell volume. We put some blood in one of these little tubes, we spin it down, it separates the red cells from the rest of the serum, and we measure the percentage of these red cells in comparison to that total volume. Most dogs are around 40, 45%. This puppy came in at 7. He was literally dying as we were holding him. So we quickly got a blood transfusion into him, and he actually survived. But that was been the worst case of flea bite anemia I'd ever seen before. Okay, moving on to equally gross. I hate these guys, ticks, which we have a lot of in Kansas. So dogs and cats both get them. There's tons of species. This one's known as the Lone Star tick. It's very identifiable because it has this white spot on its back. And if you know the Lone Star State, so Texas, it kind of gets its name from that. We have lots of Lone Star ticks in our area. So how do they get them? Okay, let's dispel the myth. They do not fall out of trees. Ticks like to hang out in the tall grass and bushes. And they do something called questing. And I don't have a picture of this. So this tick, what he would be doing is making his way out to the end and to the tip of that blade of grass. Then he's going to wait for an animal to go past it. And as the animal goes past, it hitches the right on the animal. It's known as questing. And so this is where they like to reside. There is one species, though, that likes to live in walls of homes and kennels, And so that's where you'll find them. And then we also, other animals can transmit those. So pre-patent period varies between species, and they almost all need other animal species to complete their life cycle. So like our Lone Star tick relies on the deer and the turkey that are in our area to help complete their life cycle. Symptoms, a lot like fleas, itching, hair loss, skin infection, anemia. There's something called tick paralysis that we see in dogs, and death as well. And they are carriers of many other diseases, as most of you know. Prevalence is regional. The scary thing about ticks is they may start like on the eastern coast, but they keep spreading. They do need, some of them, certain temperatures, so they'll never make it to some areas because the environment won't be right for them. But it is kind of scary how they tend to expand. There's something, one of the newer ticks is called the longhorn tick, that a few years ago got introduced to the United States on the East Coast. It's been slowly making its way west, and it's one that public health officials are keeping a close watch on. So treatment, again, we have a lot of options, topical and oral. Like fleas, don't wait until there's a problem. And then, are they zoonotic? Yes. Dogs get Rocky Mountain spotted fever. People can get Rocky Mountain spotted fever. Most of you know people get Lyme, dog gets Lyme. People can also get a disease called tularemia or lichiosis. All these can be fatal if not diagnosed correctly and treated. Okay, Earmites, we see these a lot. So we see them a lot more in cats than we do in dogs, but they are equal opportunity. So telltale sign, a lot of times we have this kind of granular dark debris. And then when we take a swab and look in the microscope, we'll see some of these eggs that are here and some of these adults. So how do they get those? They can get those through close contact with other infected animals. Pre-patent period, about 2 to 4 weeks. Symptoms, head shaking, scratching at the ears, odor, dark discharge, scabby skin. Again, common, especially kittens, and then cats. So this is a cat that had a very severe earmite infestation, so bad she was really causing a lot of traumatic wounds to her head. These are what we found on cytology. Luckily, we have a lot of treatment options. There's topicals that can go in the ear or onto the skin. They usually have to have these professionally cleaned to get a lot of that debris out, because we usually have secondary bacterial and yeast infections going on in there as well. These are not zoonotic. It'd be very rare. There were reports of actually researchers putting these in their ears to see how long they would live in people. The reports are they were very uncomfortable, but luckily it didn't last more than a couple of weeks. It can also cause some skin disease in cats and dogs as well. So this is a video of some earmites that are swimming around in mineral oil that we took from the swab. So these are pretty big mites. We can see them on a low power under the microscope. And those of you with really good eyes, young eyes, in the right light, if your pet has them, sometimes you'll see them crawling like up a hair on the inside of the ear. They'll look like a little piece of dust that are crawling up there. Okay, next we have lice. So lice affect both dogs and cats, but they are species specific, just like they are with people. So dog and cat lice will not transmit to people and vice versa. And cat lice, saved for cats. Dog lice, only like dogs. So how do they get those? Close contact with other infected animals of the same species, or fomites. So what fomites are, they're inanimate objects that we can transmit. So what would be a common fomite? A comb or brush that we're using to brush their fur with, and then we use it on the other animal. Pre-patent periods around 3 weeks. Often they are, actually I should say asymptomatic. Cats, however, can develop heavy infestations. They can be restless, have a ruffled coat, sometimes hair loss. Who do we see this in? They're usually the weak and debilitated. So they're very young, they're very old, and usually they're in unsanitary, close confined. So this is a little kitten that came in a few years ago, came in with actually a litter mate. They found it in a barn somewhere. And so these little white things you see on the ends of the fur, these are the nits. You've probably heard about nits for people as well. And so I'm gonna have to stand up a second and wave so I can get the lights back on here for a second. Or that might not happen, sorry. Another unintended technical thing. So we'll go back to this. You should still be able to see the screen. So this was a nit attached to the hair. So we're just looking at it under the microscope. This is one of the actual louses that we pulled off. Here's a nit and some of the eggs, and then an adult louse that's there. Here you can see the eggs and then a louse that side by side, what they look like on the table. So I know it's hard to tell because this kitten looks fluffy, but again, if you felt him, he was very bony under here, had a big belly. He also had roundworms and other intestinal parasites as well. So we have a lot of options. Luckily, these are easy to kill. So most dogs and cats, if they're on any kind of a flea product, it'll usually kill their lice as well. Are they zoonotic again? No, they are not. Okay, next we're going to talk about a real fun subject, maggots. So maggots come from flies. Both dogs and cats can get these. How do they get it? So usually you have a dog or a cat who's not in very good shape. They're usually weak, debilitated. A lot of times they might be soiling their fur with urine or feces. They're laying outside, maybe even inside. Flies come in and they lay their eggs around either a festering wound or these areas that are soiled by urine and feces. In as little as 24 hours, those eggs can hatch out into the larva. So what do we see? They have a very distinct odor. You can almost recognize it when they walk in the door, when that animal comes in. They have a very foul smell, and that's from that necrotizing dying tissue. You'll see the moving larva. You might see eggs attached to the hair. Oftentimes these pets are depressed, lethargic, or stop eating. So prevalence is going to be in the warmer months in hot, moist environments. Most commonly, again, when they're consistently dirty, they're seriously wounded, have impaired mobility. I just, a couple of days ago, had to have this talk with an owner who has a very old dog, and they take immaculate care of this dog. But he's at the point now where he can barely walk. It's hard for him to get up. He is starting to have urinary incontinence. In the past, they've said how he enjoys laying outside. So I actually had to talk to them about it's going to be getting warm soon. We're going to have to keep a close watch for this. So, and they will, they're good clients, but a lot of people don't know to watch for this. Again, persistent skin infections and allergies can also increase the risk for having these. So what do we need to do? We need to physically remove these maggots. There are some medications we can give them as well. A lot of times we have to work on the skin and get the dead tissue out of there as well. And then animals that are susceptible to these need to be kept indoors and monitored for signs of infestation. Are they zoonotic? No, but people can get these. If you talk to some MDs, they have seen cases of these in people. Again, usually there's issues going on. So this is gross. This is a video of an older shepherd who had been being cared for by another relative. And they were like, well, she likes staying outside. Again, this shepherd couldn't get up. He had been laying outside for several hours. He had urinary incontinence, and these are all the maggots that came off of it. Now, this is a bigger type of maggot called a Cuterebra. We don't get to see these as often, but we have a lot of fun with these when we see these. So where they come from? They come from the Cuterebra or the bot fly. So what do these guys do? Dogs and cats are what we call accidental hosts. So usually the bot fly is laying eggs around rabbit burrows. And then you have a cat or dog hanging around the rabbit burrow. And when these hatch out, these little tiny maggots enter through the mouth. They have to go through an opening. So they don't penetrate the skin. So they're going to go through the nose, to the eyes, to the mouth, something like that. And then they go on to go into some other larval stages. And they can also migrate to the brain. They can go to the spinal cord, respiratory system. They can go anywhere. Most of the time we find them in the skin, but they have been found in these other areas. Pre-patent period, 3 to 6 weeks. So they have a very distinctive look under the skin. The cyst is very, what do I want to say? They have a very firm wall, and there'll be a hole at the top. And if you look, you'll see something moving in it. And again, we can see neurologic and respiratory signs too. When are we going to see these? Warmer months when the flies are out. We have to be really careful to surgically remove these, because if we rupture these while we're trying to take those out, and that ruptured fluid goes and gets into that wound, it can cause an anaphylactic reaction in our patient. These are just a couple of medications we can use. So are they zoonotic? No, you're not going to get these directly from the pet. There are cases, human cases of this though. So this was a few years ago. We have some orphan kittens we take on from time to time that we raise. She was a 2-week-old kitten. So for perspective, she weighs a half a pound about at this age. And so she'd been doing really well. And then one night, our foster brought her in because she was running a very high fever. And our first thoughts were, she probably had a viral infection. There's a lot of bad viral infections that kittens can get. But we ran some blood work. We weren't seeing that. And when we really looked close, so this is over the back of her neck, we found this tiny hole. So you're going to focus, this is the actual little Cuterebra there. And so as you see this video go, you'll see it start splashing around in there a little bit. This was one of my most challenging Cuterebra to ever remove because it was so tiny and really hard to see. And we got a tiny patient that quite frankly is quite difficult to try to sedate or anesthetize. So for perspective, this is what came out of it. That's a flea. It was barely bigger than a flea. And yet it caused this kitten to have 105 fever. So once it came out though, she did quite well and went on to live a happy life. Okay, Sarcoptic mange. So this is what they look like on what we call skin scraping. These are the eggs we can find. These are most common in dogs, not very commonly found in cats. How do they get those? Again, direct contact with another infected dog or from fomites. Pre-patent period's about 3 weeks. What do we get? Thickened hair, hair loss. They're very itchy, secondary bacterial infections, self-mutilation, and bloody skin lesions. And so prevalence is relatively common. So this is one actually our dermatologist saw. This is a beagle. So if you know, beagles usually have nice, short, shiny hair coats. Look how thick this skin is, and there's a lot of hair loss. This is the face of this beagle, very thickened and dark from that chronic inflammation. So there's only a couple of approved options. There's other, what we call off-label medications we can use as well. They often have secondary bacterial and yeast infections. Can people get this? Yes, but they don't like to live in people. So you may be uncomfortable for a couple of weeks. And once we get the dogs cleared up, it usually self-limits and runs its course in people. People do have their own form of sarcoptic mange, but it's a different one than what the dogs get. Then another type of mange is Demodectic mange. So there's two forms. In fact, both dogs and cats, we have long-bodied and we have short-bodied. So there's species specific. This is an example of a long-bodied. You can see that really, here's the legs, long tail on that. So how do they get those? So they're considered kind of part of the normal skin fauna, but if you do a C-section, take a puppy from the mother and bottle feed it, they're not going to have Demodectic. So it is thought that they usually get these while they're nursing from mom. Short-bodied in the cats, however, are totally different. They are directly contagious. Pre-patent period anywhere from about 3 to 4 weeks. What do we get? Patchy hair loss, usually not secondary infections, itching and red skin. So in cats with short-bodied, often they present with over-grooming. And so a lot of times the skin doesn't look bad, they're just losing hair. So who do we see it in? The long-bodied form, both dogs and cats, is usually going to be the really young or the immunocompromised. The healthy immune system helps keep this in check. But they get really sick from whatever disease, we can see this pop up. And then the short-bodied are fairly uncommon. So what we do for dogs, the only approved treatment is dips, which we rarely use anymore because we use a bunch of off-label products that are less toxic, a lot easier to use. And then in cats, we don't have any labeled at all, but some of our newer flea products are showing that they work to get rid of these. So this isn't a patient of ours. I pulled this off the internet, but this cat was over grooming. This was a patient of ours. This is the short-bodied Demodectic. So you can tell this is long-bodied, the long slender tail. We got that short, stumpy little tail end area there. And then this is one of our, she was a bulldog puppy where it localized just around her eyes. The only place that had the Demodectic, you can see how red and angry that was. And again, this is the Demodectic that came off of her. We do what are called skin scrapings, but sometimes there's areas that are hard to get skin scraped, so we can pluck hairs. And a lot of times we'll find them along the follicle. So here's a hair shaft and a follicle, a hair shaft and a follicle. This is the Demodectic lying right along that follicle there. And then this is a video of the short-bodied Demodectic. This one's under mineral oil, so you can kind of see it moving and waving hello to you. So this came off of a skin scrape off a cat. All right, moving on to chiggers. You guys are all from Kansas. Most of you are familiar with chiggers. They can affect both dogs and cats. How do they get them? They're usually laying in low-lying vegetation forests. So you get them when you're walking through the grass. They need to be close to the ground because they need higher humidity levels to survive. So they're really not up in the trees or anything. So if you're sitting on the ground, you're going to be fair game for them. Pre-patent period's a little bit longer, 50 to 70 days. So what do we get? Usually what we see these more in dogs than we do cats, that red bumps on the skin, especially belly and between the toes. Those are the spots we see them a lot. They're itchy. They often get secondary bacterial infections. These guys are fairly recognizable when we find them like on a skin scrape, so they have these two little red dots right over their scutum that's there. Prevalence is regional. Not all places in the United States have these, and it has to be summer or fall. It's when we have warm, humid temperatures. So there's a lot of products that kill them, but the problem is they have already bitten. So the best thing you want to do is try to repel them. So for us, we have mosquito repellents and things that work. These same mosquito repellents can be toxic to our pets, so we don't want to use them on them. So we don't have as many options for our pets. Are they zoonotic? Yes, they are equal opportunity feeders. Some of you have probably had legs that have looked like this. This is a cat's belly. Looks a lot like this guy's leg, doesn't it? So the lesions look very similar. We tend to get, you can barely see it, but there's a little white pustule, a little pimply thing right there. If you look, if we had this really close and looked at the center of that little white pustule, we'd see a little orange dot. That would be the chigger that's there. Okay, so what do we do to try to prevent external parasites? There's a lot of topical and oral medications. Some kill, some repel and kill those parasites. There are premise treatments that we can treat the home and yard with if we need to. And then we often have to treat secondary skin infections that go along with these. And in the case of Demodectic, find out what other systemic infection might be going on that's immunocompromising them. As with the maggots and fleas and ticks, we want to try to keep them away from sources of infection when possible. Keep your weak, sick, and debilitated animals indoors. And then you want to check them daily. If you have a dog or a cat and they're going outside, do a flea and tick check daily. What we call hygienic clips for longer haired animals, where we shave the hair under the tail around the anus and the vulva, just to try to keep fecal and urine from accumulating on there. And then a lot of these newer flea and tick problems are showing efficacy against many of these other parasites. So a few final comments here. So internal and external parasites, we deal with them every day, several times a day. And they're an important role in the overall health and management for our pets. We got a lot of options on the market, but they are not all created equal. We have to know our patients. This is from several years ago, and this product's no longer on the market. But these 3 dogs came in from the same family. These are literally chemical burns from the flea product that was put on them. So that's how bad reactions can be. It is not uncommon with like flea collars to see what we call a contact dermatitis to the plastic. That doesn't necessarily mean the product's bad. It just means that animal can't tolerate it. But this is bad because it's not just one dog having an isolated reaction. We have several having a reaction. So what do you need to do? You need to talk about options with your veterinarian. And those of you who grew up to be veterinarians, you're going to help your client based on where they live and what pets they have and what activities they do with their pets. What's going to be the best option for their pets? Because they're going to know your pet's needs the best. So now that's the end of the day and you're getting ready to go home, don't eat any earthworms, right? We talked about that, or fleas. Watch out for that rice and that spaghetti, right? You never know what might be in there. Okay, so I am going to open this up to any questions that we might have. Sorry, it's dark in here now. We have the automatic lights going off. So if you want, you can unmute if you have any questions. If not, this is your time to ask. If not, we will call it a day. Okay, well, I really appreciate you joining in. I hope this brings a new perspective to these parasites and as a veterinarian, things and the challenges we have to deal with. And I'll leave it to Rachel, I think, to log you all out.
All right. Thank you, Dr. Nelson. Thank you to everybody for connecting in. And if you have any questions, I think Martha has put her email out there for you to follow up with more information, or if you have questions for admissions on K-State, we're always happy to pass more information along about our program. And you can email us at admit, ADMIT, at vet.k-state.edu. And otherwise, we hope to see you on another Olathe lecture series soon. So thank you, Dr. Nelson.
Yep, thank you. Thanks all.
All right. Have a great afternoon.
Yep.